Hi, everyone. Welcome to Connecting Families to WIC, a practical toolkit for healthcare providers, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show Captions in the bottom taskbar and select English as the spoken language. At the end of the presentation, we'll have time for questions and answers. To ask a question at any time, please use the Q&A tab in the bottom taskbar. With that, I'll pass it off to Susan Bodine, Senior Program Manager of WIC at FRAC. Take it away, Susan.
Thank you, Steve. Hello, everyone. Thank you for joining the webinar today about ways healthcare providers can connect patients to WIC and our new toolkit on this topic. Thank you also to our wonderful speakers who are the co-authors of this toolkit. And we also want to extend our deep appreciation to the Walmart Foundation for their support of FRAC's work on this project. So as we're getting started, we'd love for folks attending today's webinar to drop in the chat your name and affiliation if you want to share one, and where you're joining us from today. All right, next slide, please. Okay, a little bit about FRAC. So as Steve mentioned, we're the Food Research and Action Center, and we work to improve the nutrition, health, and well-being of people struggling against poverty-related hunger in the US. And we do this through advocacy, partnerships, and by advancing bold and equitable policy solutions. You can learn more about FRAC and the work we do through our website and newsletters. Next slide, please. All right, today you'll be hearing from the toolkit creators, Dr. Kofi Essel, Dr. Kimberly Montez, and Kate Scully and myself from FRAC. Folks will introduce themselves later on in the webinar, so you'll get to hear more about our great lineup. Next slide, please. Okay, we're going to start today's presentation with some brief information about food insecurity, WIC, and screening and intervene efforts to help level set for everyone. Then Kate will have a discussion with Drs. Essel and Montez, and then we'll have time at the end for webinar and audience questions. Next slide, please. All right, a bit on food insecurity. So many of you on today's webinar are probably really well versed on food insecurity, what it is, what the extent is in the US. For those who could use a little bit of a refresher, or if this concept is newer to you, we just wanted to touch really briefly on this. So food insecurity is an economic and social condition where households experiencing limited or uncertain access to adequate food. And this is, as you'll see in the data, this is measured at the household level. So to get a sense of the scope of this in the US, in 2023, 13.5% of households reported experiencing food insecurity. And there are certain households who experience disproportionately high rates of food insecurity. And for example, this includes Black households, Latinx or Latino households, LGBTQ+ households, and households with children. Zeroing in on households with children, nearly 18% of these households reported experiencing food insecurity in 2023. So that means that 13.8 million kids around the country lived in households that reported experiencing food insecurity. And there are households across the country who are experiencing food insecurity. And you can check out the US Department of Agriculture's data to see how the rate in your state compares to the overall average when it comes to food insecurity. Next slide, please. Right, so food insecurity and even marginal food insecurity is really detrimental to health, to development, to well-being. Just for example, children and adolescents with food insecurity are more likely to have overall worse general health, to have increased emergency department utilization, and also to have higher rates of foregone medical care. And this can present, food insecurity can present differently across households. So some common ways that families may be experiencing this include having anxiety around food, having diet monotony, decreasing their nutrition quality, or having inadequate food intake. So it's really important for us to help connect folks to programs like the federal nutrition programs that can help address food insecurity among families. So let's talk now more about one of those programs, WIC. Next slide, please. All right. The Special Supplemental Nutrition Program for Women, Infants, and Children, known as WIC, provides pregnant and postpartum individuals, infants, and children up to age 5 with nutritious foods, education and counseling, and referrals to healthcare and social services. And as of April of this year, WIC was serving more than 6.8 million people. Next slide, please. So WIC is available across the United States, and the program is administered at the federal level by the US Department of Agriculture. It's operated by state agencies in the 50 states, the District of Columbia, in 5 territories, and by 32 Indian tribal organizations. Services are provided at the community level at local WIC clinics, and these can be run by entities such as county health departments, hospitals, schools, nonprofits, and more. When it comes to the funding for WIC, this is a discretionary program. So that means that Congress authorizes a specific amount of funds for the program each year. So it's really important to ensure that the program has sufficient funding to meet caseloads and rising food costs each year. Next slide, please. Great. So WIC eligibility is based on 4 sets of criteria. First up is the participant category. So that's whether an applicant is pregnant, postpartum, an infant, or a child up to age 5. And for infants and children, it's good to know that caregivers, including fathers, grandparents, or foster parents, can apply for the children and infants. And one important feature about WIC eligibility is there's no test related to citizenship or immigration status in nearly every state. Criteria 2 is looking at income. So whether the applicant's income is below 185% of the federal poverty level, or the applicant can be considered to be automatically income eligible based on participation in Medicaid, SNAP, the Supplemental Nutrition Assistance Program, or TANF, Temporary Assistance for Needy Families. And in some states, we're seeing Head Start begin to be counted for this purpose as well. And this automatic eligibility mechanism is called adjunctive eligibility. And really what's key to know about that is it helps to streamline the process for both the applicant and for the WIC agency. Criteria 3 is whether the applicant is deemed to be at nutrition risk. So this could be a medically based risk, such as they have anemia, or it could be a diet-based risk, such as inadequate dietary pattern. And this nutrition risk will be determined by a health professional, and that's often a staffer at a WIC clinic. It's really rare for someone to not meet those nutritional risk requirements. And then finally, criteria 4 is just about location. So to apply for WIC, applicants go through their local WIC clinic. All right, next slide, please. Once they're enrolled in the program, WIC participants receive a host of important services. So WIC provides nutritious foods, breastfeeding support, nutrition education, and screening and referrals to health and social services. And these services are provided by qualified professionals such as registered dietitians. Next slide, please. Okay. A bit more on the nutritious foods part. So WIC provides supplemental foods that are designed to address the specific nutritional needs of participants. These foods are provided via a monthly benefit that comes through one of 7 science-based food packages. And the specific food package is assigned to a participant based on their life stage and their nutritional needs. And these packages can include foods like eggs, whole grain, beans, milk, infant foods, and much more. And each month, WIC guarantees a specific amount of each of these foods in the package, with the exception of fruits and vegetables, and that has a cash value benefit. The current cash value benefit for fruits and vegetables is $26 to $52 per month, depending on the participant category. And to use these food package benefits, the benefits are loaded onto a WIC EBT card, and participants use those to purchase approved foods at participating vendors. And we're really excited that in 2024, there was a new food package update rule that has a host of improvements. This update improves the nutritional quality of the foods offered, maximizes food choice to reflect better dietary guidance and accommodate cultural and individual preferences, and it makes other important improvements. Of central importance to this update solidified increases in the cash value benefit for fruits and vegetables. These updates are starting to be implemented around the country. The cash value benefit increase is already in effect everywhere, and some states have started implementing the other improved food package components, and every state has to have those in place by April of next year. Next slide, please. And of course, WIC also provides formula in some of the food packages. So WIC state agencies determine through a bidding process which retail formulas are covered by WIC. And then specialty formulas and medical foods may also be provided through WIC when they're prescribed by a physician for a specified medical condition. You'll see on this slide an example from Virginia of the WIC formulas that are covered there. If you or your patients ever have questions about what are WIC covered formulas, I urge you to reach out to your WIC state agency or your local clinic. Next slide, please. Right, and all of those important facets of WIC lead to proven positive outcomes for participants. So as just a couple examples, research has shown that WIC participation reduces food insecurity, supports economic stability, and it improves health and well-being, dietary intake, and birth and outcomes. WIC also helps reduce racial disparities in maternal and infant health outcomes, and benefits are cost effective, and they generate major savings in federal, state, local, and private health care. Next slide, please. However, as fabulous as WIC is, there is a large gap in the number of people who are eligible for the program versus those who are participating in the program. Nationally, only 53.5% of eligible people participated. So that means millions of eligible women, infants, and children are missing out on the program and its benefits. And you can see here on the left side of your screen, we also have the bar chart, which is, you'll see a version of that in the toolkit. And that shows you by age group, participant category, where we have the largest gaps in participation versus eligibility. Next slide, please. Right. And so contributing to this gap are a range of factors. Some key barriers we hear about from families a lot are things like misconceptions or misinformation about eligibility, transportation challenges, and language and cultural barriers. So there's a lot that we can be doing to close this participation gap, and it has tremendous potential for improving maternal and child health when we can connect more folks to WIC. And of course, healthcare providers are really key partners in this work. Next slide, please. All right, so we're excited to launch this new toolkit. It's designed to help healthcare providers, medical professionals, and anyone who treats or engages with families learn about opportunities to either begin or ramp up their work to connect patients to WIC. The toolkit provides key top-line information on WIC to help those who are newer to the program or those who could use a refresher get up to date on WIC. And it also has a companion piece at the end that digs deeper into how WIC works. The central part of the toolkit is all about walking folks through the different ways that healthcare providers and practices can connect their patients to WIC. And throughout the toolkit, we have features that showcase how different states and healthcare providers or practices are making connections to WIC. Next slide, please. All right, so let's talk a little bit about the different steps to connect patients to WIC that are covered in the toolkit. And of course, this is just a little bit of a teaser version, so I'm going to go through it fast, and I really hope you'll check out the toolkit to dig more deeply into the details. So you'll see there's a range of different ways you can go about making WIC connections, and really the key is to find something that works for your practice and fits within your already busy workflow. So to connect patients to WIC, of course, you want to start with preparing. A great first step for this is connecting with your local WIC clinic to learn about WIC practices in your area, the best ways to connect your patients to WIC, and how you can partner with the WIC clinic. And building relationships with anti-hunger groups in your state is another helpful pathway. They can help you learn about WIC, other nutrition programs that your patients and their families may be eligible for, as well as if there are existing outreach efforts that you can plug into. And these partners can also help you as you assess what work what would work for your practice, to learn about WIC policies and practices, to figure out who at your practice could be key in these efforts, and to have staff trainings on WIC. Next, you'll need to identify the patients who are potentially eligible for WIC. So a lot of folks are starting to screen for food insecurity around the country with tools like the Hunger Vital Sign. And these are really helping to identify patients who are potentially food insecure and could help benefit from an intervention like WIC. So screening for food insecurity is one important component, if you can add that in. And then screening for WIC as well is a really helpful way to approach it. So for WIC, a simple screener can help you identify if the patient's already enrolled in WIC. And for those who are on the program already, if they're fully utilizing their benefits. And if you're able to work it into your workflow, screening for WIC periodically every 6 months or so, or however frequently WIC recertification happens in your state, could be 6 months, could be a year. That can help to ensure that patients who are participating in the program don't fall off of it and that they're fully utilizing those benefits. And if you're able to work in universal screenings, that's a great way to help ensure that all eligible families connect to WIC, and it also helps to reduce stigma. After that, you'll start connecting your families to WIC. So there are a host of ways you can do this, depending on what works for you in your practice. You can start by promoting WIC by sharing the basics of the program, the benefits of participation for your patient's health, and by encouraging patients to apply and how to connect with the WIC clinic to do that application. You can also host your local WIC clinic for on-site enrollment if that's something that you can do. Or if they have a mobile clinic, you can see if they can visit your site or if they go to somewhere that your patients frequent, like a nearby grocery store. Some folks co-locate services. So some hospitals can run a WIC clinic and coordinate health and WIC services. Or you can also streamline WIC access for families by setting up electronic systems to help make referrals and sharing of key health data easier and more streamlined. So when a WIC clinic is doing the nutrition assessment for an applicant, they're going to use height and weight measurements and blood tests for anemia, which are things that you may already be collecting on a regular basis for your patients. So as a provider, if you're able to share that information with the WIC agency with your patient's consent, then that means the patient doesn't have to go through that same type of testing multiple times. This and other key information like demographic and contact info for a referral can be shared in various ways with the WIC clinic, depending on what systems are available. Some providers do WIC referrals through electronic health records or health information exchange. And then some providers have an arrangement to fax referrals if the other data sharing options aren't available for them. And of course, following up with families is important to ensure they're able to enroll in WIC, whether you're able to set up a system with your WIC clinic partner to get some information back, or to follow up with patients at a future important. So that was just a very quick run through. The important thing to keep in mind is that there's a lot of different options. You can make this work for your practice and for your patients. And starting with even small pieces is a great way to start, and you can grow this work over time. All right, next slide, please. And finally, a word on advocacy. So healthcare providers bring unique perspectives, expertise, and trust in the community that can be essential for improving local, state, and federal programs and policies. So in the toolkit, we also highlight the important role of providers and advocacy to support WIC and other nutrition programs. And then we also link to this resource here, which is one from FRAC and the American Academy of Pediatrics. And that digs a bit more deeply into specific ideas on way providers can engage in advocacy. Next slide. Just a few resources for you to check out later after the webinar. And now I'll hand it over to Kate for the discussion.
Awesome. Susan, thank you so much for that great presentation and all of your incredible work on this toolkit. Susan really drove the bus on this, so appreciate all of your efforts. I'm really thrilled to be here. I'm Kate Scully. I'm the Deputy Director of WIC at FRAC, and I am so thrilled to be joined by two incredible physicians who helped us write this toolkit. So we have with us Dr. Kofi Essel and Dr. Kimberly Montez, and we're just going to talk about ways that physicians can utilize this toolkit, and just their expertise in this area. So I was hoping if it would be all right with you, Dr. Essel, if you could kick us off by just talking a little bit about who you are and the work that you do, and then Dr. Montez will have you do the same.
Great. Thank you all for having me today, and it's been a joy and a privilege to collaborate with FRAC on this project. It's been a real honor. So my name is Kofi Essel. I'm a community pediatrician by training, clinical associate professor of pediatrics at George Washington University School of Medicine and Health Sciences. And my current role is I am the Food as Medicine Program Director at Elevance Health. Elevance Health, previously known as Anthem, serving over 45 million members in commercial, Medicaid, and Medicare around the country, giving me a chance in this role to really advocate for programs such as WIC for children and families. And it's a true honor to be able to do that.
Hi, everyone. I'm Kimberly Montez. I am an associate professor of pediatrics and social sciences and health policy at the Wake Forest University School of Medicine. I'm a general pediatrician and a health services researcher. My research primarily focuses on food insecurity, addressing food insecurity in clinical settings. I lead our Food is Medicine program at our academic pediatric clinic, and I collaborate with colleagues, Dr. Layla DeWitt, for the inpatient and newborn nursery programs. Our Food is Medicine program includes an on-site food pantry, a community health worker, referrals to WIC and SNAP, as well as co-located WIC clinic and a co-located DSS worker to help with SNAP referrals and enrollment. I am really honored to have had the opportunity to work with FRAC on several occasions. It's been a wonderful partnership. Along with Dr. Essel, co-authored the Food Insecurity Pediatrician Toolkit, and I'm honored to work with Susan and Kate on this WIC toolkit.
Fantastic, really impressive. I don't know how you found the time to help us with the toolkit with all of that, but we really appreciate all of your efforts. And we're just thankful for your work to address food insecurity in general. We know that physicians play such a vital role in this, and appreciate you both stepping up. Was wondering if you could kind of go back to the beginning and share with us how you first came to learn about WIC and its importance. Let's start with you, Dr. Essel.
Oh, okay, sorry.
No.
Okay, so WIC, I've known about WIC for many years. I've heard the name WIC, but you know, in training and in doing all the things in medicine, a lot of the acronyms get kind of jumbled together. It's hard to kind of tease out. So I remember in residency, that's when I really started getting a better understanding of the WIC program and how it functioned. As a pediatric resident, we got to spend an afternoon in the WIC clinic, and that was great. Spent the afternoon, learned a few things. But I didn't leave there with a full, strong understanding of how to really apply my learning into clinical settings. That, to some degree, really, it interested me. It showed me a little bit about WIC, but I needed more time with it. I was honored to be part of a specialty track, a community health track in residency at Children's National Hospital. And in that track, I got to spend extra time doing a lot of different community health work, which I was really passionate about. And one of the things I got a chance to do was spend time with a group called DC Hunger Solutions. And DC Hunger Solutions is an organization in Washington, D.C., focused on eliminating hunger in D.C. It's an organization under FRAC, as a matter of fact. And what it gave me a chance to do is spend time with leaders at DC Hunger Solutions and FRAC and learn a lot about how WIC worked, the ins and outs of WIC. I got a chance to work with state agencies. I got a chance to work closer with actually WIC partners on the ground. We had co-located WIC services in our clinical settings, and getting a chance to really integrate into those as well was really powerful. And in doing that work, it really gave me a better understanding of how WIC worked. That WIC was effective, that more than 50% of infants were born, when they were started in the WIC program, how WIC actually improved health outcomes. These are the kind of things I learned, and it was really one of those things that I continue to direct my colleagues to, realizing that there was a lot we weren't really getting in our training that we could really learn and really empower us to better connect families and patients to these great resources.
That's great. Thank you so much. Dr. Montez, how did you first learn about WIC and come to realize the importance of the program?
Sure. Well, I'm actually a product of WIC. I grew up using it. My mom used it, so I knew about it way back when. I guess sort of knew about it. I don't know if I was aware of it. But similarly to Dr. Essel, I don't think I learned much about it in in medical school or residency. It was really more when I was out in practice, just kind of completing WIC prescriptions and speaking sometimes with nutritionists, sometimes not, being able to get a hold of each other. And so kind of knew about it there, but really it was as the director of our advocacy program for our residency program, we also, similar to Dr. Essel, send our residents to WIC for a day to actually pass through the clinic as if they were a client to learn all of the services that WIC provides and to speak with the director. And one resident was particularly interested in food insecurity and WIC and was struck by the fact that enrollment and participation have been declining year over year. And how could he or how could we as a practice support that? And I'll get a little bit more into that when you ask another question, but really that's really how I got involved. We've had a wonderful, wonderful partnership with our local WIC. We love them, they love us, and we just try to work together on many, 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 many projects. And it's just been such a wonderful partnership.
That's incredible. I love that the residents go through the whole process. I think that's really incredible and eye-opening, I'm sure, for them to just not only learn about what WIC is, but to learn about what the patients will go through when they try to apply and what they can bring then to those patients is really incredible. So you both are so dedicated to WIC and to addressing food insecurity, which is great. Why do you think healthcare providers in general, why do you think it's important for them to know about WIC and work to connect patients to the program? And what about this toolkit do you think will be most helpful to them in integrating WIC into their work? Go ahead, Dr. Montez.
Sure.
Go back and forth.
Well, I am so excited about this toolkit. I have been wanting to create one, and I'm so honored to be able to work with FRAC again. I do a lot of different projects and research projects and things like that, but this project has been, it just gives me so much joy. So I'm so grateful. But this toolkit is really helpful. It goes step by step, and it gives lots of different strategies that healthcare providers can use to, I think there was a question in the Q&A about how to build relationships with local WIC and healthcare agencies. And I think the toolkit provides some examples of how to do that, as well as a step-by-step process. And so I think really just from the ground up, it provides that step-by-step process that we have actually used. So we put this into real-time use, but I definitely think healthcare providers should know about WIC and be able to refer their patients. The AAP, the American Academy of Pediatrics, FRAC, the National WIC Association, all recommend that healthcare providers connect their patients with WIC. And as you heard earlier, and many of you know, since I see many of you are from the WIC program, actually, it is evidence-based and it has a ton of health benefits. And so it also has the potential to save health systems money. So I think it's really important to connect patients with WIC and for healthcare providers to know and better understand WIC.
I'll add on to that. So when I think about this, and I've said this before, but when I think about the reason healthcare providers need to know the importance of referring into WIC, I think the first thing I start off with is the realization that the program works. The program does what it was designed to do. It works effectively. It decreases poverty, it decreases food insecurity, improves health outcomes. We see patients and families getting a chance to take advantage of it and really see the benefits on the back end of it. And so that's a really important thing to start with. The other thing that I would say that's often not understood is these early years in life are critical and oftentimes are considered forgotten years. These are years that we don't think oftentimes about the role that food and nutrition can play in these early years, but we need to take it far more seriously. We all talk about in medical training throughout the journey, there's not a lot of focus on food and nutrition. So these kind of moments sometimes can feel watered down. Like we don't, really highlight and emphasize the role of food and nutrition and the role it can play. When you think about the first 1,000 days of life from conception to the age of 2, we know that the brain is developing incredibly rapidly, and sudden insults on the brain, chemical insults, stress insults can create sort of long-term changes in the brain, which can affect development and behavior for children and families for the long term. We know that brain continues to develop, and by the age of 5, we know that the vast majority of the brain is developed. these opportunities early on to provide and connect families to these kind of meaningful programs can be powerful in reducing toxic stress, in reducing these influences that can, again, impact a poor development of a child and families as they get older. So I think it's important to realize that we as clinicians, as health professionals, as healthcare providers, have an opportunity to really get in there and support families and connect them to a meaningful program such as WIC and help them to be able to take full advantage of all the things that WIC has to offer. You also mentioned, what we think about the toolkit and the value there. And I think, Kimberly mentioned the value of the toolkit as well. And I think that one of the things that I think about is the training of the next generation. So when we are trying to prep, whether whatever health professional you are, a healthcare provider you oftentimes are working with others who are going to assume a similar role as you in the future. And to be able to equip them with skills that they can then use in a practical way is really powerful. I can give you a handout, a one-pager. I can quickly try to mention a few things about WIC with you, but this toolkit is really good. It's comprehensive. It's holistic. It gives you a lot of good detail and information that you can actively use. If you want to understand some of the research behind things, you can go into the hyperlinks and really be able to understand these as well. As a trainee, I would have greatly valued from it. And for me as a provider, to be able to then equip my trainees by reading through this, providing them a brief discussion points, being able to have an interactive dialogue with them reading through it as well. I do think that can make it really applicable for them as they move forward in their education and in their application with their patients and families as well. So those are some of the things I think can be really valuable with this toolkit. Sorry, last thing. I think there's also this piece about expanding beyond. Like, I think it's important. Like, Kimberly and I are pediatricians, but we're part of the healthcare system, right? We're not everything and all things. And I think it's important. And we get a chance to work closely with so many of our other colleagues in healthcare. And it's important to realize that this toolkit was designed not just for pediatric providers, OBs, physicians, but so many other members who are part of this healthcare team that are valuable in delivering high quality care to patients and families across the board. So that's a really important piece too.
That's amazing. I was thinking of this toolkit more of like active, offices or active doctors, but to think about it as really helping to train the future generation of doctors. I hadn't put that frame on it. So I appreciate that. There's another audience there we have for this toolkit that I'm hopeful we can get it to. So I imagine we have a lot of advocates on the call, individuals who are working to increase WIC participation. I know you both are physicians, but if you were an advocate going into a physician's office, are there specific ways that the advocates could help support healthcare professionals in connecting patients to WIC? We had a question in the chat about how do people get their foot in the door? I know, doctors are busy, healthcare providers are busy. How do they get attention on this? Who wants to start?
We're doing ping pong here.
Yep.
So I'll kick this off. Just a brief answer. I think you highlighted it. Physicians are busy, clinicians are busy. Whatever that advocates can do to streamline information to providers and provide updates as well, right? So like there's been some changes to the WIC packages. There's been some changes to what's being offered with WIC. There's been some streamlined approaches, especially during the COVID years, where we realized that there were some things that were being done that really helped onboard individuals quickly, easily took away a lot of the stress. And these kind of things we need to make clinicians aware of them so they can better advocate for them with their patients and families. Not only that, advocating is one of the things that clinicians naturally do. And to be able to be aware of some of the challenges and the pain points, it allows us to use our voice, step outside the four walls of clinical settings, and then advocate at a larger scale as well to really move the needle on these kind of efforts as well. So I think those are things that are really powerful and are things that we value as well. So streamlined information, anytime you can provide it to us, updated information in a way that's digestible, in a way that can help us actually actively apply these things into clinical settings. I think that's great. I would also mention just, keep helping us realize that you don't want us to do everything on our own, right? There's so many great toolkits and great things out there that, encourage especially primary care providers of different backgrounds to add another thing on, do another thing. And that becomes overwhelming at times when you feel like everything's on your shoulders. But to realize that we can partner with our our community-based organizations, partner with our anti-hunger organizations, and move this work forward. How do we partner with them? These are kind of things that we would really appreciate. So allowing these the advocates coming in, helping us to be able to create those seamless partnerships and move that work forward. I think those are things that could be really valuable.
I agree with Dr. Essel wholeheartedly. Additionally, a couple of other points, especially for those who work close to an academic medical center, there will always be trainees. So that includes medical students, that includes physician's assistant students, nursing students, and increasingly schools are teaching their students about the social drivers of health, such as food insecurity, and evidence-based interventions, of which WIC is one, and really sending their students out into the community so they can better understand where they're living, where they're practicing, and what their patients' lives are like. And so WIC programs in particular and other advocates can welcome those students into their programs and teach them about those programs and increase their knowledge about those community resources. So in particular, as we mentioned, WIC does that for our residency program. And because of that, we've been able to create this long-standing partnership. And we have multiple projects in the pipeline. And so it's been wonderful. And the other thing I would say is, I think WIC just celebrated their 50th anniversary. But if there's opportunity to invite the community providers, different service providers to your WIC, if for those of you who are WIC, to invite them to see WIC, to learn about WIC. There was a 50th anniversary party that I was invited to. So, if you could invite your local healthcare providers to visit you as an open house, for example, I think that's one way to get your foot in the door. And so those are just a couple of examples. I think anytime you can advocate for the program, WIC, just in particular, luckily it's not been as on the chopping block as some other programs have, but I think continuing to advocate for WIC is also a good way to support just the health and well-being of children and families, which then supports us as healthcare providers. I think there was another question in the chat about citizens, and just wanted to quickly answer that and say that WIC is available regardless of immigration status to all of those. There may be no, I think that's right. Susan, is that right? I don't think there's a waiting period.
Correct. So when WIC clinics are looking at eligibility, they're just looking at those 4 criteria we talked about earlier: participant category, income for the household, the person's location, like where in the state they're living, or if they're living in the correct state that they're applying in, and nutrition risk. So they're not, aside from one state, which if you send me your state, I can confirm that you're all good, or if you're in the affected state, only one state is looking at any sort of status information.
That's all. That's wonderful. If you have more questions, feel free to add them into the Q&A. We're kind of answering them as we go, but there's time at the end as well for some questions from you all. I also think, I've heard WIC referred to as the first food is medicine program. Like, doctors have the goal of making sure their patients are healthy. And if you don't have the right nutrition, you're not going to be healthy. And so there's a shared goal there. And I think if advocates, we can lead into that and really drive that message home, it's an investment in the health and well-being of their patients. Dr. Montez, I was hoping that maybe you could share more of like a specific example of how you've seen the WIC referral successfully happen in a healthcare setting, just so the people on the Zoom can get some context.
Sure. Well, we've come a long way, and thanks to that resident really spurred the process. We also have co-located OB. And so I think for a while, even before we started our project, they were screening patients, and they would keep names and literally write them down on paper of pregnant individuals who were interested in being referred to WIC. And then they would hand walk that list down to, I mentioned we have a co-located WIC clinic in our clinic. So we were doing that at some point in pediatrics as well. We were doing paper screening and keeping those paper screeners, and whoever and on it was, were you interested in a referral? We would literally take those down. I recognize that that doesn't work for everyone, but that is certainly one thing that you could do, is just keep a list and hand it over at some point. The other thing that we started doing was we had a patient navigator. We were able to make the referral electronic. So we worked with our IT to build a referral in our electronic health record, we taught our residents and our providers how to screen for WIC, and we had handouts available. So if families had questions, they could hand the handouts out. And then that if they wanted it, the referral would go to our patient navigator. And again, she would manually keep a list of everybody and then hand it over to WIC. Then we got even better. We were able to give, we use Epic as our electronic health record. We were able to give WIC community access. So for those of you healthcare providers who do use WIC, there is that ability to give community providers read-only access to the electronic health record. So they can't write in it notes or anything like that, but they do, if you allow them, health systems can restrict what access those community providers have, but we were able to give them access so they have their own inbox to message back and forth with healthcare providers, and that's how they receive the referral. So we did it a couple of different ways, and I'll tell you what works best and what doesn't. We did a BPA, which is a best practice advisory that fires up on the screen when the medical assistant is rooming the patient and requires her to ask those questions. And then she asked them during rooming, and then they get sent, that referral gets sent. And then the other way we did it in another clinic was we did it through the note template. So during the nutrition section of the Well Child Check, when they were asking questions about nutrition, they would ask about participation in WIC and SNAP, and then they would ask specifically there for if they were interested in a referral, and it would automatically fire if they hit yes to WICs in basket. We've done research, and we're hopefully publishing it soon, but that the BPA was much less effective because it opened sometimes when they weren't in the room, or it was just inconvenient, and they would dismiss it. We found that the note template was much more effective than using that BPA. And we did some qualitative research, and we found that that everybody was very happy with the system, except for some healthcare providers who may not have understood the benefits of WIC and were more concerned about the stigma of asking patients about WIC, so that we're a little bit hesitant. But I think if you had the provider screen, that seemed to be much more effective. We've since expanded to OB, the inpatient setting, and the newborn nursery.
I love it. It seems like there's a scale of things people can do, from, all the way to linking your electronic records, but even just simply handing off names and just asking a question. It can be so simple to really complex. So that's really interesting that there's so many ways for healthcare providers to really work this into the work that they're doing. There is a question in the chat that kind of builds off one of your last points, Dr. Montez, that I wanted to go to. It says that they sometimes hear the doctors still think of WIC as a formula program and are not supportive of the amount of juice that's provided through the program. How would you both suggest we work to change this perception? Any suggestions?
I'm happy to take a stab. I think it's a great point that's made, and definitely this is a conversation myself and my colleagues have had for many years. What I will say is a few different things. So Kate, you highlighted WIC being known as the nation's first food as medicine program. Some people say that, right? And the way sometimes we define food as medicine is that these are sort of interventions that work within healthcare to prevent, manage, and treat disease, but also focused on food insecurity and as well as diet-related chronic conditions as well. One of the things about WIC that you've seen is not the same with a lot of other programs, is that the meals or the food patterns have changed. Food patterns is not the way to say it. The food bag, the package. That's going to say basket. Food package has changed over the years. It continues to evolve over the years. As we learn more, it continues to evolve more, and things have changed over the years for sure. Some would say, so what you're noticing now with the newer package, and again, you have to kind of work with your local WIC agencies to see, is that you're able to do a lot of different exchanges, right? So you're able to access things like quinoa and teff and wild rice. You're able to replace some of the juice with more fruits and vegetables, right? So you're able to do some of these adjustments for your patients and families. And I think that's an important thing to consider and keep in mind. The argument around juice in particular is thinking about vitamin C and iron being better absorbed with that vitamin C. Do you have to do it with juice? No, you can do it with other fruits and vegetables and other things as well. So that's not a necessity for them to have to do. People do love juice, of course, right? So that's one of those things you think about. The formula piece is a big part of WIC as well. And a lot of families really benefit from that formula and love to use that formula. But I think it's important to realize the other advantages of WIC as well and advocate for that with your families and communicate that to your families as well. After that age of 1, families are not receiving that formula, and you do see a drop-off in WIC. Is it because of the formula only? The data doesn't always say it's that alone. There are a lot of other reasons that go along with that. But what we need to understand now is that, again, some of the other benefits that really families benefit from is a cash value benefit that Susan was mentioning earlier. $26 per month that children between the age of 1 and 5 are able to get, which itself acts as a produce prescription program, right? Produce prescription initiative where they're able to get fresh, frozen, canned fruits and vegetables to then be able to incorporate into their diets as well. No formulas involved. So I think there's a posturing here that we have to keep in mind and realize as clinicians, how can we advocate and realize how do we support the variety of offerings that WIC does have for patients' families that they do benefit from. We can hyper-focus only on juice or formula, but they do play a role. They can play a role if we think about this more holistically.
I'll just briefly say a couple of things. Yes, I agree there's that perception because I think there's a lack of education. So anything that anyone can do to educate healthcare providers about all of the benefits of WIC beyond just a formula and also the benefits or why juice is part of the package. I think there's that misconception and misunderstanding. Actually, the American Academy of Pediatrics does not support removing juice from the WIC package just because some children don't have as much access to fruits and vegetables, and that may serve that 100% fruit juice may serve as their only access to something related to fruit. So I think education is just really important.
And I just want to note, we did include information about the specific pieces in the food package in the toolkit to address this exact issue, because we knew that the more physicians and people who could participate in WIC know what's in this package, the better they are to understand it and to see the value. So there is like a whole chart in the toolkit for people to utilize in this way. I just want to note, someone put in the chat, I think just for us, the hosts and panelists, that the importance of referring patients to WIC even before their first OB medical provider appointment. And just to remind folks, when you're pregnant, you can get on the program. And have you all seen that happen before, like where they're being referred before they even are like in the first initial phases of pregnancy?
Kimberly has a co-located OB, so maybe that's more on her side. I will say that there are a lot of practices being done in OB clinics to make sure that the pregnant individuals are aware of WIC early on to get them connected. If you're enrolling individuals before they're starting or not enrolling, but if you're making them aware before they are actually pregnant, the question is, where is that going to come from? If it's coming from sort of internal medicine, family medicine, you may see more flyers or other. It's harder to do that based on what's being offered, but it is a strategy that can definitely work quite well. Kimberly, I can pass to you about that too.
Yeah, it's really hard because often individuals don't know that they're pregnant until, that or that confirms that their pregnancy, that first OB visit. So it's really hard to catch them, and they may not be in the health system. They may not be accessing the health system. But at least in pediatrics, if we have teen pregnancies, that's a great opportunity to, once you have that pregnancy, to immediately refer them to WIC. At least that's a potential start. But yes, I think even before the first OB, but definitely at the first OB, we know the earlier that pregnant individuals enroll in WIC, the better the health outcomes are for her and her infant.
Perfect. We have another question that was asked about how you both would recommend getting a meeting to educate physicians in their practices, and is a role within the practice that would be the best to talk to, maybe a lunch and learn. This person says that they get ignored or turned away a lot. So I know you've given some advice along this call, but like any tangible things, or is there a specific like position they should ask for when they call about this?
Great question. Oh, great question. It is hard to get into busy practices because there's a lot of priorities in busy practices. I would encourage that individual to not give up and to realize that first and foremost, and extend that grace on both sides, recognizing that everybody's just, incredibly busy. They don't. It's very unlikely that it's an intentional sort of ignoring of this important piece that they're bringing forward. I think there are a few things to keep in mind. Number one of the things Susan highlighted was the benefit of having a hunger champion, or an anti-hunger champion is another way of saying it, within a clinical space. You're seeing more of that kind of thing happening. And don't think a lot of times people just try to start with the clinic director or a clinician there, or the physician there. That's one of the ways to do that. But think about other team members that are on site as well. Patient care technicians are phenomenal. Nurses are phenomenal. Social workers are phenomenal when available. Psychologists, other team members on staff are really great. See if you can get, and if you're asking for a lunch and learn chance, try not to start off with getting 2 hours for the lunch and learn, right? Try to start off with a smaller segment of time that seems realistic and digestible for that clinic, maybe during a staff meeting. Staff meeting is a key word that often works, but trying to get 15 to 20 minutes, 10 to 15 minutes that we can come in briefly, provide some resources and for your clinicians and your staff around this. So I think really using some of those magical words around making sure that they are aware that it's not a lot of time, short snippets of time. This is what we plan on covering. Is it possible? Try to identify a champion if you can. If you cannot identify a champion, identify other team members who are there. Sometimes these lunch and learns, virtual or in person, getting a whole hour is a phenomenal opportunity, whether during clinical time or even after clinical time as well. Those are great opportunities as well. Last thing I'll say is in academic centers, in academic health centers that are tied to universities, those are oftentimes a great opportunity because you have a lot of learners who need to learn about a lot of these kind of things. So going through those residency opportunities gets your opportunity in front of a large number of people, residents, medical students, trainees, and that can also filter into some of the other clinicians as well.
Thank you. That's helpful. Yeah, staff meeting. I wouldn't have thought of that, but doctor's offices probably have staff meetings, and that's a great way to talk to a lot of people. Dr. Montez, any other magical words or ways advocates could now? Well, we have a few minutes left. I wasn't sure if maybe you both could kind of round us out, and if there's one thing health providers could do to start this process, one thing they could take away from this toolkit, just kind of final thoughts.
Kimberly,
Sure. I'll jump in really quickly and answer one of the questions I think that was posed. Yes, we have tried. I'm on a team of providers who have met with the HIE team in North Carolina, and we have reached out to WIC. And I think there's some concerns about it's the WIC equivalent of HIPAA. Unfortunately, our North Carolina state WIC I don't know what to call them, staff at NCDHHS have had turnover, and so we're just kind of waiting for them to hire their new director. But we hope to continue that conversation. One thing that providers can do, well, I think if you first, attending this webinar is really great. Sharing it with others, reading through the toolkit, I think is the first step. It's a fantastic toolkit and very comprehensive, as Dr. Essel has said. And then really just going to your local WIC office and touring it, meeting the WIC folks and establishing a relationship with them. Again, as somebody mentioned, we have the shared goals, we have the shared population, we're taking care of each other, and we're often trying to communicate and miscommunicating just because of the way fax isn't the best way to communicate. So yeah, those would be the first steps, I think, which are pretty easy.
You would be surprised what can happen once you start that conversation and open the door with your local WIC clinics and your local WIC agencies as well. Some of the things that you might have seen, some challenges, some pain points, having those conversations, figuring out ways to streamline communication, identifying some of the challenges around, hey, could you do online referrals and these kind of things. The toolkit really lays that out really well. And so I would double down on open the door, have that communication. The last thing I would say, and Kimberly and I have done a lot of work on this in the past, is if you haven't already decided to do this, consider starting the process of screening, intervening, and advocating. What do we mean by that? Make sure you're screening for food insecurity using a validated screening tool, such as the Hunger Vital Sign. Make sure if you are screening that you have tools in place, such as WIC and other valuable tools that you can then connect families to. And lastly, use your voice. Step outside the four walls of clinical settings and make sure you're advocating to see the change we need to see for our patients and our families. These are critical things that you can do.
That's amazing. And I do want to shout out to our Children's Health Watch friends who did help create the Hunger Vital Sign. It is included in the toolkit. So if you're not sure what that is, check it out. It's 2-question screener. It just makes it easier for physicians to screen their patients so that they can then intervene. Well, I just really want to thank you both. I'm going to turn it back to Susan to close us out.
Yeah, thank you, Dr. Essel and Dr. Montez and Kate, for that amazing discussion. The time flew by. And thank you all for joining us today. It was great to see so many folks on the call. As Steve mentioned at the top, this is recorded and we'll be sending out the recording as well as the slide deck to everyone who's joined the webinar. So we hope you'll share it around, use it as a tool as you're working to connect with WIC clinics, connect with providers. And we're just so thankful to have you all here, to see this work grow around the country. And also wanted to do an additional thank you to our funder for the project, the Walmart Foundation. So thank you all for joining. Stay tuned for a follow-up email. And yeah, reach out to the FRAC WIC team if you have any questions or would like to talk through more on WIC. We look forward to hearing from you. Thanks, everyone.